shoulder discomfort, tightness, or weakness can make it hard to do simple tasks that we take for granted on a daily basis. In order to make your sore shoulder feel better, the first step is figuring out what caused it in the first place. Unfortunately, this can be a daunting task due to its extensive list of potential sources. The non-athlete fitness team has put together another resource for you in this video with common causes of shoulder pain and what you can do about them. Let's take a closer look. So how can I tell if my shoulder pain is serious? You can usually tell when there's something wrong with your shoulder. However, how can you tell whether it's just sore, or if there's an injury that's actually present and needs medical attention? Pay attention to these signs that may signify a shoulder injury. Intense and abrupt shoulder pain. Limited mobility in your shoulder. Shoulder area discomfort accompanied by tenderness, swelling, pressure, or bruising. Ongoing pain or aches that become increasingly severe. Agonizing aches that keep you from falling asleep or that wake you during the night. Finally, despite taking time off, icing the area, and utilizing over-the-counter anti-inflammatories, no relief from the pain has been achieved. So what are some common causes of shoulder pain? Number 1. Bone spurs. These small, polished outgrowths called osteophytes press against and gradually erode your rotator cuff, eventually limiting its normal mobility. Repetitive movements may result in tendinitis or a rotator cuff tear. Number 2. Separation. This injury affects the AC joint, which is located where your collarbone and shoulder blade meet. In the event of a fall or hard impact, your collarbone can become dislocated due to torn ligaments. This will be made clear by a bump atop your shoulder as it slips out of its proper position. Number 3. Fracture. If you take a tumble or experience a hard impact, your bones may fracture and break. The collarbone and arm bone closest to the shoulder are among the most common breaks that occur in such instances. The pain and discomfort from a broken collarbone can be intense, leading to bruising. Additionally, your shoulder may droop and you might find it difficult or impossible to lift your arm. Number 4. Rotator cuff tear. Comprised of 4 muscles and their tendons, the rotator cuff keeps your shoulder in position while allowing you to move it up above your head. Without proper care, it can easily become worn out or damaged. Additionally, its condition deteriorates as the years go by. Discomfort and crepitus in your shoulder may be observed at night or while attempting to lift items. A crackling sensation could also occur when the area is moved. Number 5. Frozen shoulder. This illness hinders the mobility of your joints. Scar tissue, also known as adhesions, accumulates in the joint and restricts its movement range. When your shoulder begins to feel frozen, it could be because of the lack of use due to injury or surgery, and this in turn can cause adhesions to form. Number 6. Impingement. Is your shoulder feeling inflamed and tender? You may be experiencing a pinched rotator cuff. This occurs when the tendons of this muscle become compressed between the bones in your shoulder, especially with frequent overhead arm motions. If so, take action to reduce irritation for faster recovery. Number 7. Bursitis. Constantly repeating the same motion can quickly result in inflammation and tenderness of the bursa, a fluid-filled sac that offers support to your joint. In addition to repetitive activities, bursitis can be triggered by a fall or other injury. When you move your shoulder, the discomfort from the condition may become especially noticeable. Number 8. Osteoarthritis. Osteoarthritis, commonly referred to as degenerative joint disease, is the most prevalent type of arthritis. Arthritis can wreak havoc on any joint, including your shoulders. Over time, the cartilage between bones wears down and they start to rub together, causing pain and stiffness that is all too familiar for those with this condition. Number 9. Rheumatoid arthritis. Rheumatoid arthritis is a persistent, inflammatory disorder that targets multiple joints. In an unfortunate reaction, the body's immune system mistakenly targets and destroys its own tissue. Uncontrolled swelling and inflammation may cause irreversible bone damage, as well as joint deformities over the long term for those suffering from rheumatoid arthritis. This is because it affects the linings of joints, which leads to painful swelling. Unfortunately, there is no known cure for rheumatoid arthritis yet. However, physiotherapy and medication can help to manage the progression of this disease. Number 10. Cartilage tear. Our shoulder joint is encased by a rubbery cartilage, providing it with protective padding. However, exhausted movements within the same range can lead to its damage over time. Additionally, your shoulder can experience damage in the event of a fall or any instance where it incurs significant impact. If you are suffering from this type of injury, then it is possible that you experience discomfort when lifting your arms above your head and notice a decrease in the strength of your shoulder. Additionally, you can be met with sensations such as catching, locking, or grinding, which further complicate matters. Number 11. Referred pain. Referred pain is pain in another area of the body that is felt due to a problem with a distant organ or tissue. Referred pain can manifest as an intense burning sensation, sharp prickling pains, or even dull aches. It may be localized in one location on your body or spread across multiple areas. If you experience shoulder pain without any discernible cause, it could be a sign of something amiss with your gallbladder, liver, or other internal organ. Number 12. Dislocation. If your shoulder is stretched excessively or rotated too much, it may result in the top of your arm dislocating from its socket. Shoulder tenderness and weakness will be felt upon injury, accompanied by swelling, numbness, and bruising. Number 13. Tendinitis. Tendinitis might be the result of gradual strain over several years, or it can take place in an instant after a fall or forceful hit to your shoulder. It is caused by inflammation of the tendons that make up your rotator cuff. Number 14. Heart attack. If you are experiencing immense shoulder pain, difficulty breathing, or a sensation of tightness in your chest, it is imperative that you seek immediate medical attention, as it may signal an impending heart attack. So there you have it. Shoulder pain is an all too familiar affliction, likely due to the ordinary wear and tear that our bodies endure. Living life daily can be a strain on our joints, that's just how it is. However, when the pain you feel in your shoulder prevents you from performing everyday activities like washing hair, it's time to seek medical attention. Combining physical therapy with rest and other home remedies may prove beneficial in resolving the issue at hand. Want to learn more? Be sure to check out the other videos on our channel and the resources below to help improve your health and fitness. Until next time.